Veterinary Medicine Digital.
The mode of transmission of leishmaniasis in foxhounds particularly, but dogs generally in the US, is still controversial. In Europe and other countries where leishmania is endemic, such as South America as well as the Mediterranean basin, the main mode of transmission, of course, is the vector Phlebotomus or Lutsamia, blood-sucking insects. To date, no vector has been identified to carry leishmaniasis in the US, although a considerable amount of work looking for a particular vector has been done. So it's believed that in the case of foxhound leishmaniasis, that vector transmission does not play a role. The question then arises as to how transmission occurs in this particular breed. At this stage, we know that foxhounds, dams that have leishmaniasis, quite often and are quite capable of passing it vertically to their young, and that several litters have been identified with leishmaniasis that have been born to a positive bitch. The problem, however, is that the puppies from these positive animals do not show clinical signs or even seropositivity for years until after they're born. So you can have misdiagnosed puppies for up to 3 to 4 years from positive dams that have leishmaniasis but don't manifest it for a long time. This is confused, in many cases, the transmission type of cycle. The other modality that we think is important in transmission in foxhounds is direct contact. And not only foxhounds, but there have been some cases within the US where direct contact could have been the only mode of transmission. And this means direct physical contact. The animal has to directly contact a lesion that contains leishmanial organisms with to be transmitted directly through the skin or a mucous membrane of that dog. We have also investigated some cases of transmission possibly occurring by coitus. However, that in this country has not been confirmed. It's been suspected in cases but has not yet been confirmed. Where does this put us as far as transmission or the possible transmission of leishmania from dogs to people? Certainly amongst the foxhound group, any people associated with breeding foxhounds or stud masters taking care of foxhounds have been uniformly to date negative for leishmaniasis. In fact, there has not been a human case of leishmaniasis attributable to contracting it in this country in the last 10 years. This strongly argues that leishmania in the foxhounds is not a strong zoonotic source for the disease in people. However, we should always be diligent that we don't contact these dogs too closely, because we know that direct contact can occur, can result in transmission. The other controversial point associated with transmission from dogs to people is the question of whether dogs infected with leishmania and undergoing concurrent treatment are also infectious not only to vectors but to other dogs or people. And the consensus seems to be that in actual fact they are not very contagious to dogs or obviously people. However, there have been studies overseas which suggest that dogs undergoing treatment can still infect vectors. So that raises the issue that even dogs that are being treated for leishmaniasis, they still could be, even though it's very slight, a possible source of infection to people. And we should be diligent in warning owners of these foxhounds and other dogs that they need to take care in handling these animals. Leishmaniasis is not transmitted in the urine of dogs. However, open wounds are by far the most common source of contact transmission, and an animal that has severe ulcerating disease should be strongly looked at as a major source of contamination, not only to other dogs or to people. And actually, you may consider euthanizing these particular animals.